Hi, Ashley Browning. So I'm going to describe how you do a proper venipuncture, blood draw. Um, First thing is, if I see on my paperwork that I have a patient coming back for blood work, I'm going to go ahead and set my tray up with my tubes in the proper order. So it's there, it's ready. Make sure that if more than likely I'm going to be using a butterfly needle, so make sure that my needle is in my tube correctly screwed on. Still leave the cap on until my patient gets there so everything remains sterile. So now these are not the right color, but I just have examples of test tubes. I have my gloves and alcohol swab. So I would set my tray up in the order, which in this case it goes, well, okay. So my light blue would be for the PTIRN. So that's going to go first. Then I can use, which this one I can show. This is tiger stripe kind of. Which that one can be used for two of them, the BUN and the cholesterol. And then we'll need, so pretend I have two of those. So now I have three of them ready for my tray. And then I would need a lavender one for my CBC diff. Okay? So have all that set up, prepared, ready to go for the patient. I'll call the patient back, make sure I wash my hands and stuff in front of them, make sure I'm sterile. I apologize. Okay, so I'll make sure my hands are nice and clean and identify the patient, confirm who they are. I'll explain to them what we're going to do. Now, I'm not going to go into every detail because some people get weak, get scared, they can pass out. So I'll also make sure that they're sitting down just in case they do pass out. So then I will put my gloves on. Which I don't have everything, unfortunately. I wasn't able to get it in time, so I'm just going to explain some things. One tip I know from my mom, anyways, is, if I can get it, well, I can't get it, but tipping your glove just so you can feel a little bit better with your finger to palpate the vein and make sure you find a good vein. Okay, so you'll want to apply the tourniquet about 3 inches above the area where you're going to be doing the blood. If you can't get a good vein right here, maybe the person's dehydrated, their veins might be, have gone flat, or could be rolling and just giving you a hard time, then I would put it about 3 inches above the wrist to try and get a vein in the hand. Which then, I'll take my alcohol swab and clean it real good once I find a good vein. Leave it alone once you find the vein. Don't need to tap it or anything else again. I'll then take the cap off my needle, which, I've already set up. It's already screwed into the tube. I'm going to ask my patient to make a fist also, just to help the vein come up. And then I will slowly apply the butterfly needle. From what I know, which I'm not exactly sure, I think like around a 21 gauge needle is normally good for drawing blood. So we'll just make sure that we put it in to where, you're not going too deep. You're just going into the vein and you're just going in just enough. Okay. Then once I have the needle in the vein, then I'll start applying my tubes, the vacuum, tubes into the tube, um, which then should produce the blood flow. Now, you don't want to do this procedure too slow because, you need to go ahead and get the blood and then remove the tourniquet because you can cause the patient's blood to start clotting, which that's not good for anybody. And once I'm done with that, then I will go ahead and have my gauze up at the top, not on top of the needle yet when I go to remove it. It'll be at the top. I'll remove the needle and then roll the gauze down. Then I can also ask and remove the tourniquet. Then I'll ask the patient to hold it and apply pressure just for a second, to stop the bleeding. Label the tubes and, put a Band-Aid on them if the blood hasn't stopped, and send the tubes off for label them and send the tubes off for testing.